Hello everyone, Gabby here from bootcamp.com, and for today's video, we'll be talking about the meninges and the dural folds. When we think of the layers that make up the scalp and the layers that also make up the meninges, we can actually divide these areas into three separate regions. So this first region here is going to go ahead and represent the scalp. And the scalp is going to be found immediately superficial to the bone or to the bone of the skull. We'll then see immediately deep to the bones of the skull, we're going to be able to see the different layers of the meninges and the spaces that these meninges create. So if we start off with our layers of the scalp first, so most superficially, and we're going to work our way to deep. So to remember the layers of the scalp, the easiest way is to really use the word scalp. So we're going to use our word scalp to help us differentiate between these layers. So most superficially is where we're going to find the skin. So the skin is going to make up the most superficial layer of the skull, and we can see that over here. Now, the next layers I'm going to talk about are not depicted in this image, but I want you to pretend that they're all part of this area over here. So if we look immediately deep to the skin, we're then going to have a layer of connective tissue. And this connective tissue is going to be dense and very vascularized to provide the blood supply to the areas of the skin. Deep to that connective tissue, we're going to find the aponeurosis, also known as the epicranial aponeurosis. And this epicranial aponeurosis is a very thin but strong sheet that runs along the areas of the skull that essentially serves as an attachment point for a couple of our muscles of facial expression. And this includes the connection between the frontalis muscle on the areas of the forehead and the occipitalis muscle on the areas of the occipital region of the head. So the skin, the connective tissue, and the aponeurosis, so the three first layers, are very tightly adhered to each other. And immediately deep to those three layers, we're going to find a layer of loose areolar connective tissue. And this loose areolar connective tissue allows for the free movement of the layers of the scalp along the areas of the skull. So for example, if you take your hand, put it on your skull here on your scalp, you can actually move the skin on the areas of the scalp. You can actually see it as I'm moving it right now. But nonetheless, this loose areolar connective tissue allows that free movement of the scalp along the areas of the skull. Next, for number 2, we're going to have the periosteum. And you may have heard this word before. Periosteum is always associated with bone, right? So think os, and peri meaning above. So this layer is going to be found immediately above the bone or the areas of the skull over here. So the bone here is going to be considered our second area immediately deep to the skull that again will really form that protective vault that will protect the brain itself. Immediately deep to the bone, we're now going to start talking about the meninges, and we have 3 different meninges, and more superficially, we have the dura mater. And dura mater literally means tough mother. So this layer is very, very thick and very, very tough. I'll actually show it to you in the next slide, and actually contains 2 different components. So the first one over here is going to be the periosteal or the endosteal layer that is directly adhered to the bone itself. And between this bone and this dura mater, we have a potential space called the epidural space. And epi meaning above. So again, this is the space that is found above the dura. Now I mentioned that the dura mater has 2 separate layers. So we just talked about that periosteal layer that is adhered to the skull. Immediately deep to that periosteal layer of the dura mater is where we're going to find the meningeal layer of the dura mater. And we can see how these 2 layers are essentially connected together along these areas. But eventually what happens is that middle meningeal layer will start to invaginate inwards. And as it invaginates inwards, it essentially creates this space in between the 2 layers of the dura mater. And this allows us to actually form the venous sinuses that are found in the areas of the brain. So if you remember correctly, the venous sinuses allow for the venous drainage of the brain to occur. So in this particular case, we have the superior sagittal sinus over here, that will also be found in this area here that will run along the superior and along the sagittal plane of the skull. Immediately deep to this meningeal layer of the dura mater, we're going to find the arachnoid mater. And arachnoid meaning spider. So this layer really looks like a spider web. It gives off these little projections here of connective tissue that makes it have this spider web appearance. So in between this dura mater and this arachnoid mater, we're going to find the subdural space. So sub meaning under, so underneath the dura, we have the subdural space. So the epidural space is above the dura and the subdural space is below the dura. Immediately deep to the arachnoid mater is where we're going to find the pia mater. And pia mater means delicate mother. So this layer is a very, very thin, delicate layer that is actually immediately adhered to the brain itself. And this pia mater is actually going to go and follow those sulci along the areas of the brain. It can be very difficult to really distinguish the pia mater from the actual brain tissue itself because it is so adhered to the brain. And now in between the arachnoid matter and the pia mater, we also have a space called the subarachnoid space. So remember, sub meaning under, so the subarachnoid space is underneath the arachnoid matter. And within the subarachnoid space is where we're going to contain the cerebrospinal fluid. So the cerebrospinal fluid will travel in between or within the subarachnoid space along the areas of the brain and along the areas of the spinal cord. So it's important to remember that the meninges are surrounding the brain itself, but they are also surrounding the spinal cord within that spinal canal. So if we compare the epidural space, the subdural space, and the subarachnoid space, the only true space out of these three areas is the subarachnoid space. We consider the epidural space and the subdural space potential spaces, and by potential really means that there shouldn't be anything there. There should be no blood, there should be no fluid. It's only really when we have some injury or trauma to the areas of the skull that we can actually get fluid or even blood accumulating in these potential spaces. Next, we'll talk about the blood supply to the dura mater. So if you remember earlier, I said I would show you a picture of the dura mater. So we can see here on our cadaveric image on the left side, this layer that we're seeing right over here is going to be the dura mater. So you can see how tough and thick that layer is. And this we're going to find immediately deep to the actual skull or to the bone itself. And if we think of the blood supply to the meninges overall, the blood supply is usually done by these meningeal arteries. But the middle meningeal artery over here is one of the branches off of the maxillary artery as it travels within the IT fossa. So the maxillary artery will travel in the IT fossa and then give off that middle meningeal artery that will essentially ascend from the IT fossa and pass through the foramen spinosum. So it's going to pass through the foramen spinosum to enter into the skull and then eventually give off branches that will go and supply the dura mater and supply some of the rest of the meninges. We also have adjacent to that middle meningeal artery is that accessory middle meningeal artery also coming off of our maxillary artery that will eventually ascend into the skull and enter into the skull at the level of the foramen ovale. So the middle meningeal artery will be the foramen spinosum, and then the accessory middle meningeal artery will be the foramen ovale. Okay, we're going to move on now and talk about the dural folds. So the dural folds are made up because of the layers of the dura mater. I'm actually going to go back here to our first slide to better show you how these dural folds are formed. So remember that we have two layers of the dura mater, so the periosteal layer and the meningeal layer. And I mentioned in certain areas of the brain where these meninges are located, we actually get this splitting of these two layers. And we'll essentially get the invagination here of this meningeal layer as it travels down. So we get it on this side and we're also going to get it on this side. So essentially what's happening is that as it's invaginating inwards, eventually this meningeal layer will fold on itself, travel back up, and then eventually merge again with that first layer or with that periosteal layer of the dura. So the folding that occurs in this area actually creates these dural folds that will separate certain areas of the cerebrum as well as the cerebellum. So if we think of our first dural fold here, I'm going to mention we have 4 in total, and the first one is going to be the falx cerebri. Now the word falx essentially means sickle. So the falx cerebri does take on this sickle shape as it does fold and separate those two hemispheres. And the falx cerebri is going to run along the sagittal plane of the head and of the brain along this area. So if we look at our superior view of the skull here, the green line is going to represent where that falx cerebri runs. So in this case, the falx cerebri is going to split the brain or split the cerebrum into left and right hemispheres. We can also see it along this posterior view here. So again, the green line representing where that falx cerebri would be located. So again, we can see the left and the right hemispheres of the brain. Next, we have the tentorium cerebelli. So instead of running in a sagittal plane like this falx cerebri, the tentorium cerebelli is actually going to run in a more transverse direction. And cerebelli, so if you use these names to your advantage, right? So cerebri is going to divide the cerebrum, and the tentorium cerebelli here is going to split the cerebrum and the cerebellum. So we can see that over here. We can actually see parts of that tentorium cerebelli that have been cut away so we can better visualize some of these structures of the brain. But we can see the cerebellum over here, and then we can also see the cerebrum just immediately superior. Our third dural fold is going to be the falx cerebelli. So similar to the falx cerebri, we also have a falx cerebelli that will go and separate the cerebellar hemispheres into left and right halves. So we can see here that the falx cerebelli and the falx cerebri both run in that sagittal direction versus that transverse direction for the tentorium cerebelli. Now our last dural fold is the diaphragma sellae, and the diaphragma sellae essentially acts as this sheet or this blanket that sits on top of the sella turcica. And the sella turcica is a super important structure on the skull that houses the pituitary gland. And this diaphragma sellae lies on top of this pituitary gland and surrounds it in order to protect it. So all of these dural folds work together to maintain the structure and integrity of the brain. They also prevent displacement of the brain as we move the head, for example, and also allows us to maintain the proper functioning of certain brain regions. All right, so let's see what you've learned today. So label the layers of the skull and the meninges, and then come on back when you're ready. So the very first, more superficial layer, we're going to have the skin. We're going to see underneath the skin and those layers of the scalp is where we're going to find the bone, or what actually makes up the skull itself. And then immediately underneath the bone is where we're going to find the meninges, right? So we have the dura mater, so we can see the periosteal layer over here, and we can see the meningeal layer over here. So those two layers of the dura mater. Immediately deep to the dura mater, we have the arachnoid mater in purple, so we can see the spider web-like appearance here, so there's extensions of the arachnoid mater as they travel within this subarachnoid space. So remember the subarachnoid space, sub meaning under, so it's underneath that arachnoid mater, and really is the only true space, right? We have the epidural space, right, in between the bone and the dura mater. Then we have the subdural space in between the dura mater and the arachnoid mater. But you can see here that there really is no space there. It's a potential space. And these spaces will only get larger if we do get some type of hemorrhage, or if we do get some fluid accumulation in between these layers. And then lastly, adhered directly to the brain itself, we're going to have the pia mater. Next, we have a 42-year-old patient presents with severe headaches, visual disturbances, and hormonal imbalances. Imaging reveals a pituitary adenoma. During surgery to remove the tumor, the surgeon encounters a dural fold separating the pituitary gland from the hypothalamus. Which dural fold is likely to be encountered during this procedure, and what is its specific name? And then next, we have a 55-year-old patient presents with a sudden severe headache associated with vomiting and altered mental status. Imaging reveals a subarachnoid hemorrhage, and further investigation indicates that the source of the bleeding is a ruptured aneurysm in the circle of Willis. During surgery to clip the aneurysm, the surgeon encounters a dural fold separating the cerebral hemispheres. Which dural fold is likely to be encountered during this procedure, and what is its specific name? So pause the video, come on back when you're ready. So for our question number 2 here, we're talking about the dural fold that essentially separates the pituitary gland and the hypothalamus. We know that is specifically the diaphragma sellae. And next, for number 3 here, we have the dural fold that separates the cerebral hemispheres. That is going to be done by the falx cerebri. So the falx cerebelli will separate the cerebellar hemispheres, and the falx cerebri will separate the cerebral hemispheres. We'll then see that tentorium cerebelli running in the opposite direction, so transversely, to separate the cerebrum and the cerebellum. Here are the references for all the images I used today, and I hope you enjoyed this lesson on the meninges and the dural folds. Please let us know if you have any questions.